identity with matrix number KIB100502, and I'm going to present on the prevalence and risk factors of diverticulitis. Diverticulitis is characterized by the presence of inflammation associated with symptomatic diverticulum. This may happen due to the obstruction of the neck of the diverticulum, leading to accumulation of mucus and increased pressure with progressive transluminal inflammation. Recent evidence suggests that 4 to 7% of patients with diverticulosis will develop diverticulitis, which is the most common reason for diverticular disease leading to hospital admission. In Western countries, diverticulitis is predominantly left-sided, while Asian countries have a higher incidence of right-sided diverticulitis. The prevalence of diverticulitis is also higher in women than in men between the ages of 50 to 70, but more common in men under the age of 50. Until now, the main cause of this disease is still unknown, but many researchers are aware of the possible factors that are linked and increases the risk of this disease. The mostly debated factor that has been going around for some time now is the lack of dietary fiber. Most scientists agree that this lack of fiber in an individual's diet can cause the hardening of stool and may lead to abnormal pressure within the colon to push the stool down. Secondly, genetics also is seen as another factor of this disease. According to an experiment performed on 2 sets of twins, of identical and fraternal twins, the risk of diverticulitis increases in manifold if one of the twins has been diagnosed with the disease. It has been estimated that around 40% of all diverticulitis cases have been heavily influenced by heredity. Another main risk factor is age, as older people are more likely to develop this disease than younger individuals. However, individuals who develop diverticulitis at a young age are more likely to experience diverticulitis and be admitted to a hospital than older individuals. Obesity is also seen as a huge factor. A number of studies have shown that individuals with a higher body mass index, or BMI, are at a higher risk than those of a more ideal BMI. The risk of diverticulitis in a smoker is also much higher than a non-smoker, because the habit of smoking contributes heavily to inflammation in the body, and that will ultimately lead to diverticulitis. Regular usage of non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen have been also linked to an increased risk of diverticulitis. And lastly, physical activity such as running or any other vigorous activity can be seen to decrease the risk of developing diverticulitis. That's why those who are often physically active are less likely to develop diverticulitis compared to inactive individuals.
Hi everyone, I'm Tan Irong, KIB100566. Today I will discuss about the formation of diverticulitis. Before we understand the formation of diverticulitis, we need to know the anatomy of the large intestine, as the formation of diverticulitis is at the large intestine. This is the 2D formation of the large intestine, and I will discuss the part of the large intestine. This is the appendix, a blind lymphoid pouch located in the right iliac fossa, which arises from the cecum. Here is a cecum, the first part of the large intestine lying in the right iliac fossa of the abdomen. Here is the ascending colon, the portion of large intestine located between cecum and rectum, and it travels through the right iliac fossa, right flank, and right hypochondriac region. Here is the hepatic flexure, which is the right angle band in the colon on the right side of the body, near the liver, that marks the junction of ascending colon and transverse colon. Here is the transverse colon, which is the second major part of the colon, which extends between the right and left colic flexure. Here is the splenic flexure, which is the sharp band between the transverse colon and descending colon. The connection after the splenic flexure is descending colon. The colon extends between the left colic flexure and sigmoid colon. Here is the sigmoid colon. The S-shaped colon travels from the left iliac fossa until the third sacral vertebra. This is the rectum. The muscle stretched between the rectosigmoid junction and the anal canal. The last part is the anal canal. It forms the terminal part of gastrointestinal tract and extends from the anorectal junction to the anus. As the diverticulitis always occurs in the colon, we also need to know about the colon. The colon has 5 layers, which is combination of epithelium, connective tissue, and thin muscle layer, also known as mucosa. The second layer is submucosa, which is the layer of connective tissue arranged immediately under the mucosa layer. The third layer is the muscle layer, and subserosa is the fourth layer, which is a thin layer of connective tissue between muscular layers and serosa. The outer layer of the colon is serosa, a layer of simple squamous epithelium associated with connective tissue. Now, let us talk about the formation of diverticulitis. When the pressure inside the colon increases due to some reason such as constipation, the mucosa and submucosa will herniate through a weakness area of the wall of the colon and form diverticulum. When the diverticulum becomes inflamed due to the invasion of colonic bacteria, the diverticulitis are formed. So, this is the process that the diverticulitis are formed.
Hi, my name is Jojin Ru. My matrix number is KIB100568. Today, I will be presenting the treatment for diverticulitis. There are 4 types of treatments, and each treatment is depending on the severity of the signs and symptoms. First of all is the antibiotic treatment with oral agents. For outpatients with milder diverticulitis, when the bulky pouches are small in the patient's digestive tract. Another treatment is treated by liquid diet and rest more. If the condition is uncomplicated diverticulitis, the patient needs to have liquid diet for a few days while the bowel heals. Once the symptoms improve, generally, the patients can add some solid food to their diet. Furthermore, the intravenous antibiotics is used by directly injected into the veins when the patient have severe attack or have other health problems and he or she must be hospitalized. The last treatment will be surgery. There are 2 types of surgery, which are primary bowel resections and bowel resection with colostomy. This resection method is emphasized by Smith-Wick in 1942 and has been confirmed by many others such as Pemberton, Black, and Minor, and etc. This surgery method can minimize the condition of repetitive bleeding, patients with obstruction, patients who have had colostomy performed and failed to improve, and particularly those who continue to discharge bloody mucus by rectum. The primary bowel resection, also called partial colectomy. Resection is another name for any operation that removes tissue part of an organ. The surgeon removes diseased segment of patient's intestine and then reconnect the healthy segments to allow the patients to have normal bowel movements. Bowel resection is done either by opening the abdomen or by laparoscopy, depending on the amount of inflammation. Another surgery is bowel resection with colostomy. If the patients have many inflammations that is not possible to rejoin the colon and rectum, the surgeon will perform a colostomy. An opening in the abdominal wall is connected to the healthy part of the colon. Waste passes through the opening into a bag. Once the inflammation has eased, the colostomy may be reversed and bowel reconnected. All types of surgery carry some risks. The risks include infection, bleeding, heart attack or stroke, blood clots, difficulty in breathing, and etc.
Hello, my name is Yui K, matrix number KIB100503, and I'll be explaining about limitations of current treatment for diverticulitis. Before we look into limitations, let's have a look on current treatment for diverticulitis. As what my groupmate has presented earlier, current treatments include liquid form diet, antibiotics treatment, IV antibiotics, which are injected directly into our veins, and surgery for more complicated cases. So what are the limitations of current treatment? The first limitation is recurrence of mild diverticulitis leading to complicated diverticulitis. As mentioned earlier, antibiotics can be used to treat mild diverticulitis. However, even though patients fully recovered from the first episode of diverticulitis by antibiotics treatment, there is still a chance of recurrence which can turn into a more complicated case of diverticulitis. In rare cases, recurrence can also occur in patients who have undergone bowel resection surgery, which is a typical surgery to treat complicated diverticulitis. A study by a researcher of American University of Beirut in 2018 suggests that 20 to 35% of patients go on to develop diverticulitis again within few years after successful recovery, and new episodes of diverticulitis sometimes lead to serious complications. Next, invasive surgical procedures of diverticulitis are also one of the limitations. Primary bowel resection and bowel resection with colostomy are both traditional surgeries to treat complicated diverticulitis. The limitations of these surgeries are invasive operations which include the use of colostomy bag. How is the surgery performed? The colon end of infected area is diverted to a pouch, which is the colostomy bag, outside of the patient's body to collect feces. Colostomy is a major and complicated surgery which significantly affects the life of patient after surgery, as he has to carry the colostomy bag with him everywhere he goes. Infection and internal bleeding are also risks possessed by bowel resection with colostomy surgery. Some people also experience urinary tract infection after surgery. Lastly, limitation of current treatment for diverticulitis includes complication of surgery. Like all surgical procedures, diverticulitis surgery possesses risks such as anesthesia complication problems, blood clotting, and bleeding problems during surgery. Moreover, diverticulitis is often diagnosed in older patients, especially aged after 40, where risk of surgery often increases with age. Older patients tend to have more health complications and diseases too, such as hypertension, which is known as high blood pressure, and this increases risk and complication of surgery even more.
Hi, I'm Lai Koi-chi, KIB100503. I'm going to talk about what can I do to improve the life of affected patients as a biomedical engineer. As a biomedical engineer, what can I do to improve the life of the affected patients? As what stated before by my group member, mild diverticulitis can be treated with antibiotics and liquid diets until the condition turns better. But this treatment couldn't solve the problem completely. The patient might experience a more severe condition in which, in this case, it requires a surgery. However, there are many things that we need to take into consideration. For example, an elderly who has other diseases like hypertension, diabetes, and etc. For these patients, they might have a higher risk if they need to cope with an operation. That's why it is very important for us to make some improvements for prevention of complicated diverticulitis once the patient was diagnosed with mild diverticulitis. As we know, the formation of pouches in the colon are due to the high pressure within the lumen of colon at weak spots. Therefore, as a biomedical engineer, I would like to suggest a technique which is similar to coronary angioplasty as to reduce the possibility of formation of diverticula. First, let us look at this animation. So, this is the guide wire, and the gray color one is the balloon catheter. So, for this case, the balloon catheter is pushed over the guide wire and centered at the narrow blood vessels. Then, the balloon is inflated and deflated for several times to expand the narrow vessels. This process can happen in the coronary arteries, which is located at the heart. Similarly, this technique can be also applied in our colon, especially the narrowest part of our colon, which is sigmoid colon. So the balloon angioplasty can be inserted into the colon, and the balloon is inflated and deflated for several times to expand the lumen of colon. Once we expand the colon, the diameter of the colon will increase. Therefore, the pressure inside the lumen of the colon will decrease as well. Thus, it will reduce the possibility of formation of diverticula in the colon. As a long-term result, the risk of having a surgery as treatment for severe diverticulitis can be decreased significantly as the formation of pouches or diverticula decreases. However, this technique is just an idea of me to improve the current treatment available. Yet, there are still many considerations that we should take into account before we apply this in the reality.
Hello everyone, my name is Eugene here, and my matrix number will be KIB100509. So today for my group presentation part, I will be doing the presentation of diverticulitis and also the summary part. So there are many prevention to prevent the diverticulitis. The first and foremost for us is to take high fiber diet. So actually high fiber diet including foods like fresh fruits, vegetables, whole grain, bran cereals, which we usually consume meat for our breakfast. So all these food and many more actually contains a high percentage of fiber. So how does fibers actually help us? Fiber actually consists of two categories. The first one will be insoluble and the second one will be soluble. For the insoluble fiber, it helps our body to reduce the transmission time of the waste from one part of colon to another part of colon in very short time. For the soluble part, we will actually help our body to make the stool softer in texture so that the stool will be passing across the colon easily and faster. So actually many people nowadays actually add this flaxseed inside their drinking water as well. So this flaxseed is actually a very high fiber food as well, so that they consume it during drinking, so that this flaxseed help to make the stool softer and easier to pass through the colon. And for the recommendation part, for men, we should take about 35 grams of fibers a day, and for women, about 28 grams of fibers per day. So for the second part, we should drink a lot of water every day. As we know, fiber absorb water and it helps to soften the stool. So that this process is very important, because when the stool can pass by the colon easily, it will not lead to constipation, and lastly leads to diverticulitis. So for the recommendation part, we should drink at least 8-ounce glasses of water per day. For the third prevention, we should never ever smoke. This is because from an experiment done among 2,000 participants, among 1,200 of the participants with smoking habit actually have higher risk of getting diverticulitis compared to another 800 who does not smoke and has lesser risk of getting the disease. So smoking actually causes the build-up of heat inside our body, and when it reaches the colon, can actually cause the colon to form a bulging object called diverticula, and in plural is diverticulum. So this actually leads to bursting of the diverticula when pressure in the colon increase. So this is called as diverticulitis. So this actually leads higher risk to diverticulitis, and it also reduces the colonic contraction in our body, so that it makes constipation harder, and also a factor to leads to diverticulitis. So we should never ever smoke. And for the fourth part, will be exercise regularly. This is because this helps to promote normal bowel function and reduce the pressure inside our colon. And physical movement during the exercise will help to pass food easily through the intestinal system. So for recommendation, we should exercise at least 30 minutes on most days. So for summary, once we diverticulum form in our colon, it will stay there permanently, and this will lead to easier condition for diverticulitis to happen. So this disease is actually lifestyle disease, and it can be prevented when we practice a very good health lifestyle. So for the higher risk factor age group, there should be more concern of their lifestyle to prevent this disease. So thank you everyone for listening.